Are more children getting hospitalized with COVID-19 now that the Delta variant is so prevalent in the United States?
Yeah, and in this population of children, those are the ones that are least likely to need to be hospitalized or even die from the virus. But yes, in the last week, and we're talking here at the beginning of August, in the last week, there's been an 84% increase in the number of hospitalizations in children. That, according to the American Academy of Pediatrics. Now, coupled in with that, we're also dealing with a spike on top of a Delta spike called respiratory syncytial virus, or RSV. And we're seeing that together with a lot of these patients as well. So that is part of the equation. Realize that anybody that's under the age of 12 in the United States can't currently get a vaccine. There's no vaccine that's been given emergency use authorization for those children. So I guess if you wanted to see a clear picture of what would be happening right now if we didn't have vaccines, you can look at that population, which is arguably the best protected population against the virus.
And speaking of children, what do you think will happen this fall when kids go back to school and college campuses reopen?
Yeah, so this ties into the previous question about what do we do with the peak. So it really depends on when the peak starts to come down, coupled with when children go back to school. I know that, for instance, in Canada, kids go back to school right after Labor Day. So that starts fairly early. There's other college campuses that typically start later in September. There's other private schools that start in August. So it's sort of going to be a slow buildup in the months of August and September. And if they go back to school and they're not wearing masks, well, that's going to indelibly allow for some transmission of the virus. But again, this is in a population of kids that are not typically the ones that end up hospitalized. Now, if you look at that area there of school-age children going from college age at the age of, let's say, 20, going all the way down to school-age kids in kindergarten or pre-kindergarten, down to the age of 5. Now, vaccines are going to help the upper portion of that age group, but not the lower portion. So it's going to be a mixed picture to see what happens. That mixed into it, there's a lot of college campuses that are mandating or requiring college students that come on campus have to be vaccinated. So that's going to be an interesting variable in the equation. A lot of this stuff is going to be a wait and see. And there's going to be a lot of debates about whether or not kids can go back to school or whether or not they should be wearing masks. And it's a political question. All of that is going to weigh in and may either speed up or delay the Delta variant peak.